Good evening. Welcome to the Buck Stops here. I'm Vishnu Shom. On the program tonight, a new report from the Center for Science and Environment shows that lifestyle diseases or non-communicable diseases are responsible for more than 61% of all deaths in India. Whether it's heart diseases, respiratory illnesses, cancer, obesity, or food allergies, new research reveals that the rise in their incidences is due to factors such as rapid urbanization, air pollution, and changes in diet rather than exclusively our genes. The new report is called Body Burden, Lifestyle Diseases. It is essentially a report card on the state of health in India. Among its key points, the Central Pollution Control Board has done a large-scale study which shows that every third child in Delhi has impaired lungs. Acute respiratory infections have risen by 30% since 2010. Air pollution causes 30% of all premature deaths. The number of overweight and obese people has doubled between 2005 and 2015. The prevalence of obese and overweight children in India is over 19%. So you're asking, why are we talking about pollution and why are we talking about obesity? Well, these are just two key components in this report which looks at a host of lifestyle-related ailments, illnesses, and non-communicable diseases. Pollution, obesity, it comes in that category. Both come under that broad category. So effectively, we are killing off a generation of Indian citizens because of the choices that we are making. What are the implications of the report? That's our big focus. But first, our big story, the report on lifestyle diseases. What are the implications? Effectively, are a generation of Indians dying earlier than they should have.
Meet 12-year-old Pritika Jesudesan, an active gymnast, footballer and dancer, but now restricted to her classroom and home because of repeated complaints of chest congestion.
School, we don't get to go out for PE, which is physical education. Usually we go out, do drills, and otherwise it's fun, but otherwise we're in our class getting conversations.
Her genes are healthy, parents are fit and have had no damaging ailment. But that's not enough. She is still vulnerable like millions of other children in the National Capital Region.
A study by the Central Pollution Control Board says that every third child born in Delhi has an impaired lung. As scary as the statistic sounds, this has been known. What has now come to light is even more dangerous. Lifestyle disorders contribute to 61% deaths in the country. Now, everything from your lung disorder to heart diseases, to obesity, cancer, and even disorder in eating, the rise in all of this is due to environmental factors.
So what is this lifestyle disorder?
They do not transmit from one person to another. These are chronic, they last you for your life. Some of the examples which are really very common now in India now are diabetes, cancer, asthma.
According to the Center for Science and Environment, which has come out with a report, acute respiratory infections have risen by 30% since 2010. Air pollution causes 30% of all premature deaths. Climate change is disturbing the pollen season, triggering a rise in respiratory allergic diseases. The World Health Organization cites studies to state that in India, a whopping 12 million people are affected by chronic obstructive pulmonary disease or COPD.
How clustered is your neighborhood? How long are your working hours? What quality of air you're breathing? And what are you putting into your system? All this will now contribute to what your child will become. And with the air pollution levels rising yet again and the urban lifestyle we all lead, it's time perhaps to ask, is this the life we want to leave behind for our kids? With camera person Prem Singh, I'm Sonal Mehrotra Kapoor for NDTV.
There are so many numbers and so much detail in this report, and the end result is, at one level, it's also frightening. What exactly are we doing with our health? What are we doing with a generation of Indians? To me, as I see the news run down today, the politics being played out in Gujarat, the developments in the Supreme Court, they're all very important, but they all seem to pale in significance to something that affects our lives. And are we really talking enough about all of this? Dr. Sunita Narayan, the Director for the Center for Science and Environment, is with us this evening. Dr. K. Srinath Reddy, the President of the Public Health Foundation of India, as well on the program. Dr. Soumya Swaminathan, the Deputy Director General of the World Health Organization, and will be joined by the spokesperson of the BJP, Shaina NC. Sunita, let me come to you first, because I think the point over here is that, in as much as we will talk about air pollution, when we talk about lifestyle diseases and when we talk about non-communicable diseases, it all comes together in one gigantic grouping, right? And it's all of these factors which come together which seem to be making us live shorter lives. Would that be a fair overall assessment?
No, absolutely, Vishnu. And I think the most important for me, the two takeaways that we must have is one, that the toxification of our environment, this lifestyle that we are now leading, is not about just environmental pollutants, but the way it is affecting our lives. It is about the food we eat. It's about the antibiotics in our food, the pesticides in our food. It's in the plastics that are there, which have other toxins in it. So it's a combination that we need. It's an assault on our bodies. And we must understand that environment is today about health, and health is about environment. And the second thing that I just want to flag is, our minister, everybody always tells us, no doctor gives us a certificate that you have died because of pesticide poisoning in your food or because of air pollution. But the fact is, today there is enough evidence that those triggers are well known. But it is also true that unlike diarrhea, unlike cholera, unlike the communicable diseases, this bunch of what is called the non-communicable diseases, the cause and effect is very difficult to establish often. And that is why it's even more important for us to talk about it, to scream about it, because at the end of the day, if we talk about environment, it's today about our bodies.
Dr. Swaminathan, let me come to you next. What Sunita was mentioning over there is that when a person goes to a hospital, possibly loses their life because of a heart attack or another condition, the reason for that heart attack can never be ascertained in most cases. And yet we now know through so many studies that there are a host of causes. Is it a concern to you as the Deputy Director General of the World Health Organization that the reason we may not be talking enough about this is because we can never pinpoint the exact cause of death?
Yes, Vishnu, I think there's some truth in what you're saying. Most of these diseases are what we call multifactorial. Unlike an infectious disease, tuberculosis or malaria, where you can pinpoint the pathogen, most of the non-communicable diseases have a variety of risk factors that then lead up to a particular disease over a period of time. But there's also enough evidence now, and in fact in the report that was published just about 2 weeks before the CSE report, which was done by the ICMR, the Public Health Foundation of India, and the IHME, we've analyzed in detail the state level disease burden and the risk factors that account for this, and in fact shown a clear shift away from communicable towards non-communicable diseases across India, starting with the more so-called developed states, but extending now across India. I think I'd just like to make a couple of other important points. As we have an aging population, we're bound to see an increase in non-communicable diseases like cardiovascular diseases, stroke, and chronic respiratory diseases and cancers increasing because they are associated with longer lifespan. But compared to many of our neighboring countries and compared to some of the BRICS countries, India has got not only a shorter lifespan or life expectancy, but also a higher rate of DALYs, which are the disability adjusted life years, which account for both deaths and years lived with disability that's been weighted, which means that our population is really carrying a higher burden of chronic diseases. And that, I agree with Sunita, has a lot to do with our environment, the air, the water, the food, as well as our personal habits.
Dr. K. Srinath Reddy, let me just ask you, just going to delve into a couple of the statistics over here. 61% of all deaths in India, according to the study, are linked to non-communicable diseases and lifestyle diseases. We've established that. But let's break it down and look at one of the leading causes of this. Let's talk about air pollution once again, because the numbers are that the acute respiratory infections have risen by 30% since 2010. Air pollution causes 30% of all premature deaths. Why, sir, has it taken us so many years to wake up to this reality? Because, you know, it's been 7 years. It's taken us 7 years to come up with this data. Did we not know what was killing us earlier?
I believe that could not quantitate it precisely earlier. We now know that about 1.8 million Indians die every year because of air pollution, 1.1 million because of outdoor air pollution, and about 700,000 because of indoor air pollution. While people die of heart attacks, stroke, lung diseases, and even other non-communicable diseases which are related to air pollution, the mechanistic pathways of how this is caused was not entirely clear, but now they are much more clear. Even when we talk about obesity and diabetes, for example, we know that inflammation which is provoked by air pollution can actually cause endocrine disruption and can lead to both obesity and diabetes. But much more importantly, the inflammation can lead to heart attacks and stroke. The risk of stroke is increased twofold at Delhi levels of air pollution, and about 1.5 times for heart attack. So now we are able to much more precisely link what the amount of risk is. Earlier, we could not quantify it as well as we can currently do it. But now I think the figures are fairly stark and alarming, and an urgent call to action.
Shaina, you know, this is a segue in a sense to between what the doctor was saying and what we face once again in the national capital. 421 was the count today as far as air pollution was concerned. It's back in the severe category. 8 out of the 10 most polluted parts of India are in the national capital. Then you have this mammoth report which actually brings together what so many people around the world are saying. When is the government going to do something to save our lives? Let's be immediate, let's be focused. Let's talk about now in the NCR. We are back at severe levels. What is the center doing?
Vishnu, I don't think it's absolutely correct to put the entire onus on the government. It has to be a collective collaboration between people. There is a choking capital, there is a choking city, and there is a choking situation. There is, I mean, just to give one statistic which has baffled me all day, where you come to know that every third child in Delhi has either impaired lungs, yes, and has air pollution alone has caused over 30% of all these premature deaths. So that is what we breathe, which I think is extremely crucial. People say you are what you eat, and you know, the chronic diseases such as obesity and diabetes can be fought. Yes, that's correct, but that's at a personal level. But the air we breathe is clearly something that belongs to every single citizen and individual. I just want to raise 1 or 2 points. One is, you know, look at the amount of transportation fumes that one sees in the atmosphere today. Not just Delhi, Mumbai and all the metropolises, whether it's Bangalore or Pune or all the statistics that have been given. But I think it's important to understand that, you know, on one hand we talk about more Ola and Uber and cabs and transportation, but on the other, we have so much pollution that is caused to the environment, which is actually killing India. So lifestyle diseases is one thing that can at least be combated through changes at a personal level, but the government needs support of public participation. We need to have private and public participation in multiple issues, and this one statistic which has shaken us all up is obviously testimony to the fact that in the years to come, unless we get our act together on multiple issues collaboratively. We'll just be thinking of what is the health foundation.
Fortunately,
of
that
India
recognition
doing,
has come. It's come late, but it has come.
What is the deputy
Will
director of
successive
WHO
governments,
doing?
whether at the center or the state, actually do something about this? I just want to look at two other points in as far as the air pollution part is concerned, and then look at the issue of obesity, because there are so many different parts of this report. We need to spend more time on all. But 13% of all deaths in India occur due to chronic obstructive pulmonary disease. 22.2% are the estimated chronic COPD, 22.2 million is the estimated chronic COPD patients in 2016. 35 million estimated chronic asthma patients in 2016. The total cost of treatment of chronic obstructive pulmonary disease has annually increased by nearly 5 times in the past 2 decades. Sunita, this is obviously a health number and how it's affecting us. How does this number have a direct link to the economic output of our country?
You know, Vishnu, I often say this, and I don't really, at some level I don't want to sound frustrated or annoyed, but we have a real conspiracy of silence on many of these issues in our country, because there is such weak data. At the end of the day, today in Delhi we have some better idea of the pollution levels, so at least we know how badly we are affected. But this data drives policy, it drives behavior change. And the question you've asked me about economic costs is such an important issue. Just think about, Soumya just talked about the disability, the dailies. That means the number of working days that we are losing because of these illnesses. And the only point to me that is also very important to drive at is, remember, communicable diseases, the burden that we still have, vector-borne diseases, malaria, diarrhea, cholera, maternal, those are all still easier to treat and clean. When you're dealing with this new bundle of diseases, you are really talking about chemicalization of the environment, the industrialization, which is actually leading to the increasing susceptibility of our bodies to get cancer, to get heart diseases. It's those guns that are being fired at us that we need to make the links on. And I think that's the big thing for me as an environmentalist is we need people to understand environment is not about pretty trees and tigers, it's not even about pollution, it's really about our health. And that's really I believe the major issue that can also change things for us in the future.
Okay.